All right, Lucy, it's all yours.
All right. Thank you so much, Michael. You've been a great organizer and moderator. I think there's another career coming your way. Um, and I want to thank everybody who is in the audience. It's been 2 long days with just a lot of information. And thank you for those who are still here with us, hanging out with us. I know it's towards the end of the conference, and so people are getting tired. I hope I will have your attention on this topic. So my name is Lucy Kibe. I am the program director at the Charles Drew University of Medicine and Science PA program in Los Angeles. And I actually came into the PA profession kind of as a second career. I was previously a public health professional, and that is where I really kind of got my feet wet in research. And so coming into the PA profession, of course, I brought that love with me. And so I'm very passionate about getting PAs to get involved in research. You know, I always telling people research is not a bad word. It's not that difficult to do. You can learn how to do it, and you can actually do it. So my goal for this session is really to give you some tips on some things that you can do, give you an overview. This is a topic that is courses that you can take on every single slide that I showed today. Probably is a whole course or a whole session. So it's just to give you an overview. And at the end of this session, my goal is to make sure that you are inspired and that you feel like you can actually do this, and that you have just some resources that you can take with you to get started. So I want you to think about your favorite gadget or invention, and think about your life without it. There's so many innovations out there that make our life easy. For me, my most absolute innovation that I really appreciate is disposable diapers, because when I was raising my kids, I could not imagine washing diapers, cloth diapers every day. So I'm really happy. I'm really glad that somebody invented disposable diapers, and somebody else came along and made the invention even better and better, and so we have that today. And when you look around, you can see a lot of things that you don't know how you would live your life without them. All of those things came along because somebody did some research and improved upon those innovations, and now we get to enjoy them. So today we're really just going to talk about the basics of how you do research in healthcare. We'll explore just some ways to develop and refine some research ideas, just so you know where you can start from. We'll just touch very little on grant writing and publishing or disseminating your findings. And then we'll just take a few minutes also to talk about how you can leverage AI tools to enhance your research journey. It's a lot easier to do research today than it was, a couple of years ago. So we'll briefly just touch on that. So I get asked this question all the time: research versus scholarship. These words they're very intertwined. But just to give the academic kind of a definition of them, research is really more hypothesis driven. It's you're generating new knowledge. People are called researchers. You're discovering new things or synthesizing existing knowledge into something newer. But the key difference is that research is very systematic. You're answering a question in a very systematic way. And when you think about scholarship, it's more broad. You're just a seeker of knowledge. You're said to be a scholar, right? So you're acquiring knowledge, learning from many different ideas, reflecting on those ideas, and then even transferring that knowledge as a teacher in one way or another. So that is the difference. And for PAs, what we want, and NPs and everyone's in the audience, everybody's really a scholar, and everybody should really seek out to be a scholar. And if you want to do research is part of scholarship. So I don't want people to think, oh, for me to be a scholar, I have to do this very specific research. I have to be a researcher. I have to know everything. No, you can be a scholar, and that is really encouraged. We're all scholars. We all have to do CMEs. And so that is part of scholarship as well. So I'm going just to go through some types of research that you can do, and then we'll also talk about scholarship. So we're all familiar with the basic medical research, the bench scientists that are out there with pipettes and just doing gene mutation and cloning genes and all of that, researching, say, cancer. And then we have clinical research that involves humans. It's usually cohorts of people where researching how to prevent disease or treat disease or diagnose disease. For example, screening to prevent cancer. And then there's translational research, which takes the basic medical research and then translates it to clinical research. So it's kind of from the bench, to the bedside. So when we're talking about cancer drug development and so on, so that's translational research. And then we have population health research. This is where you're working with larger communities, looking at broader health outcomes. For example, you might be looking at cancer health disparities by, say, gender or by race or by age, and so on. And implementation research is a little different kind of research where you're not really asking questions. You are looking at questions people have asked and suggestions of how those questions could be answered or what the solutions could be. And then you're taking those solutions, implementing them, and then evaluating your program for success. For example, they've done these transportation vouchers where they give people a voucher for transportation to a colonoscopy. And then they look back to see, are the people who got vouchers, were they more likely to get their colonoscopy versus those who did not get vouchers? So you're implementing something and then just evaluating success. And big in the PA community is operations research, where you're looking at systems and techniques and policies and just looking at the role of PAs and the values that PAs bring and so on. And a lot of those types of research are being done by PAs and are really encouraged because they increase the value of PAs all around. In terms of scholarship, like we said, very broadly defined. So if you're publishing any work, if you're advancing your education, say you're enrolled in a doctorate or in another master's, that is a scholarship. Us being here today, me giving this presentation and you listening to the presentation, we are engaging in scholarships. So this is something you can put in your CV that you attended this conference, and it shows that you engaged in scholarship and learning and increasing your knowledge in many different areas. If you're peer reviewing journal articles or books, you are engaging in scholarship and grant applications, which we will talk about briefly. Okay, so why should we bother? I mean, we are all busy clinicians, and we have our work cut out for us to see patients. Why should we bother with research or scholarship here? Now, well, and unfortunately, PAs, we don't do enough research compared to other health professions, and we need to contribute, to make a contribution to doing research, to be able to also contribute to the health and wellness of people. We can't just sit and wait for other people to produce the information and we just be consumers. We have a lot to contribute, and so we should be part of those health providers that look for answers to health problems. And then we are always a source of knowledge for our patients, our families, our peers, our communities. So we have to be up to date on what's going on so that we're able to provide that information to them. We also want to advance the PA field, and I'll show you briefly, how if we don't do that, somebody else will do it, but perhaps in a negative way. And for yourself, for your own professional development, expanding your knowledge, and adding that to your CV, maybe having an article that you've published to add to your CV, and that goes a long way for your next job or promotion. Okay, so here are some two examples of research that has been done that has really been valuable for us as PAs. So the first one showed that PAs are effective and efficient. So they looked at removing PA supervision and whether that affected patient care. And what they found is that it did not affect patient care. PAs were still able to provide care that was efficient and effective without PA supervision. And this led to a bill being signed removing collaboration agreement requirements between physicians and some PAs in New Hampshire. So this is an example of work that was done that really advanced our profession. The second one was looking at the impact of the advanced practice providers, including PAs, staffing in an emergency care department. And they looked at productivity, flow, safety, and experience, and looking at a team that had advanced practice providers versus teams that didn't. And what they found is that when you had advanced practice providers on the team, the productivity and the safety and the experience of patients was actually much better. So that showed how much peers add value in the health system. So these are really good examples of people who got engaged in this, put this information out, and it really helps to advance our profession and our brand. However, here is another study and this is the article that you have. Unfortunately, I don't think we'll have time to go through it together, but I'll give you some pointers and you can read it later on and really understand the importance of us being involved in our own research. So this manuscript was actually looking at physicians versus non-physicians in a cosmetic dermatology practice. And they were looking at patient and physician perspectives of outcomes and adverse events. So, so basically, they were comparing, do physicians do a better job than non-physicians? But what you will find is that when you read the article, you will find this table. There's a table for physicians, the physicians that were involved, and then the non-physicians. The group of non-physicians, they grouped everybody together. So you have the aesthetician, the nurses, the spa staff, PAs, and then some other people who we don't know who they were. And they were all doing these procedures in the dermatology clinic. As you can see here, there was only 17 PAs involved. And when you look at the group of people that were grouped into this non-physician, PAs are very well trained compared to these are people we are trained in the medical model compared to some of these categories here. So grouping us together and very few of us, and then saying that non-physicians are not effective was really a misrepresentation of our brand. If they had taken physician assistants out of this group and looked at them against the physicians, we probably would have found that we provide comparable care. And a lot of other research has been done showing that we provide comparable care to physicians. So this is an example of a research that was done that was not really very well representative of this non-physicians. And just take a look at this the article itself, the title there, and look at the authors. Put in the chat what you think, what you see here. What is the common thread with the authors? Okay, they're all MDs, right? So they were all MDs. They have this study where they're comparing physicians and non-physicians, and there is no non-physician in the authorship, So what happens is that, authors control the narrative. And so if peers are not at the table, they may be on the menu. And so it's very important for us to make sure that we are at the table, because the risk of others doing research about PAs without PAs is very high. So we have to be involved, we have to advocate for ourselves, and we have to do it well. Okay, so I hope I have convinced you that you need to get involved in doing research. But then the question is, where do I begin? Our PA education is very fast paced. It's very rigorous. There really isn't enough time to get us very to learn more about how to do research and where to begin and how to do all of these things. But after you're done with your education, now that you're practicing, I think it's time that you can start to pick up these tools. And so I'll give you some tips on where you could start. So start with your just natural curiosity. When you're in clinic seeing patients, or if you're an educator, or if you're a student, listening today, and as you're listening, there's some things that just pique your interest, and you're like, I wonder why this is. I wonder why this happens this way. I wonder why this group is this way. I wonder why the waiting room is always full and our workflow is not working. I wonder why these patients keep coming back to the ED. You may just have a natural curiosity about something. It may be something, maybe it's a medical condition that in your family or you have, and you're very interested in studying that. So things that are related to you, things that you hear, things that you read about, and you find these gaps, and then they interest you, is really where to begin. And then you can also consider national and AAPA research agenda. So there's this agenda that has been put out, and I'll show you some of those, that can give you an idea of, oh, this is what is the priority out there. So maybe I should align my natural curiosity with these priorities. And then you're going to refine your questions. You start broad and you're going to refine your question. And then after that, you use a scientific method to satisfy that curiosity. So here is the AAPA National Research Agenda. You can find these online. So AAPA has come up with these topics as the top priorities for the PA profession. So they have divided it into high priority, medium priority, and low priority. And you can see it's mostly related to PA value, workforce, PA education. So high priority areas are, for example, cost effectiveness of PAs, patient outcomes, when patients are seen by PAs, supply and demand of PAs, and so on. And you can find more information on how you can drill down to a question by reading the journals, learning at conferences like this or national conferences. They have AAPA has a research CME section that you can look at. They have a mentor match opportunity online, and they have this research fellowship that you can apply to be in. And AAPA also partners with a lot of other organizations where you can find opportunities for that. And reports and data requests are available from all our 4 organizations. They collect a lot of data. Sometimes you get this link to answer a survey. Those surveys and the data that is collected is available upon request, and you can use that then to answer a question if you're interested. Okay, so besides the AAPA agenda, there's also the national priorities. So you're asking yourself, what is really important that I could study that, I want to make sure I'm studying something that's important. So this document, Crossing the Quality Chasm, came out a couple years ago. And they said, the healthcare system, the health system in America can be improved in these 6 dimensions: patient safety, care effectiveness, patient-centeredness, timeliness, care efficiency, and equity. And each one of these just is a broad overview, but there's so many questions that you can think about when you think about patient safety in your own clinical practice. And then a few years ago, they kind of updated it into the quintuple aim. And this is the national priority. This is our U.S. national priority on optimizing the health of individuals and populations. So when you look at this circle here, there's so many questions that you could ask from all these categories. If you're interested in improving population health, you can say, how do we prevent a certain disease? How do we manage a certain disease in a way that is cost effective? What about improving provider well-being? In my clinic, are the providers burnt out? How can I study that? And how can I improve that? What about patient care experiences? How could I improve that? So, and advancing health equity. So you can look at many different questions within these different areas. And these are our national priorities. So, when we talk about grant writing, you want to make sure that if you're writing a grant, you want to focus it on the priorities that have been put forward as national priorities, and for us as PA priorities. And a lot of them tend to be intersected. So you have your question, you're very curious, you start reading up on it, right? You want to learn more about it so that you can then design your project. So just some tips here on basic literature review. You want to make sure that you're using reputable resources. So Wikipedia is not where we go to get our scientific knowledge. You want to read things that are like PubMed, ResearchGate, things that are coming out every day, new things that are being put out there, peer-reviewed journals. Books are good for general information, but they get outdated even before they get published. So you can read books just to get an idea, and some things never change anyway, like textbooks. A lot of things never change, but some information in books just really gets outdated quickly. So you want to make sure that if you want the most recent information, you're looking at peer-reviewed journal articles from reputable journals. And then you're going to find a lot, because now there's so much information online. If you go on PubMed and you just put a few keywords, you're going to get thousands of articles that talk about that topic. You can't possibly read every one of them from beginning to end. So you have to practice this method of skimming and scanning, reading just the abstract, for example. Make sure you're looking at the authors, just like we saw. If you see an article, you're like, who are the authors? Are they qualified to be talking about this topic? And look at the date so that you're not looking at very outdated information. And using keywords will kind of help you narrow down when you're looking at the PubMed, ResearchGate, or Google Scholar, or others. There's several And then now in this day and age, AI is very good at helping you to just kind of narrow down your resources, and we'll be talking about that a little bit. There's a lot of AI tools out there to make the work a lot easier for you, so you can start to understand the topic, and then you can determine where to go. So this slide here really summarizes the research process and the steps that you would take to start your research. So we talked about identifying the problem. So the first thing, that natural curiosity that we just talked about, you start with your problem. What is it really bothering you that you want to study? Then we talked about evaluating the literature responsibly. Then you're going to create a hypothesis and say, this is the question I have. From my reading, I think that probably this is the reason why this particular thing that I'm interested in is happening. And then you say, and so you create a hypothesis and say, now I'm going to test that hypothesis and say, am I right in my kind of guess on why this is happening? And then you study that, and you may be right or not. Either way, it's good information. Then you design your research. And the way you design it is very important because it will determine whether the findings that you get at the end are reliable. So it's very important to make sure that you're designing your research well. Describing your population, that kind of narrows it down because you can't possibly study everybody in the country. So define your population. Then you start collecting your data. So collecting your data, you can be doing surveys, it can be interviews, it can be those data sets that you get from AAP or PAEA, it can be just mining data from the internet. There's so many ways that you can collect data these days. And then data analysis, it can be as simple as an Excel spreadsheet, or it can be as sophisticated as using a statistical software and involving a biostatistician. Then once you have collected your data, you've analyzed it, you start now to try to make sense of what is this really showing me. You start to make sense out of the different connections, and then you write your report. And whether that's a manuscript, whether it's a report, whether it's a pamphlet, it can be anything that makes sense depending on who your audience is. And when you do that, you're going to actually end up with so many other questions that will be generated, and then you start the process all over. So we say research is not a destination, it's really a journey because you never stop asking questions. And once you answer a question, it generates more questions and you keep going. So we're going to go through two practical examples using that wheel of two projects that I have done. And hopefully you'll be able to see that you can really do this with the question that you're really curious about. So the first example is a project that is in progress that is related to colorectal cancer screening among minority patients. So my curiosity was, colorectal cancer screening is covered by the Affordable Care Act. And colorectal cancer screening is important because it saves lives. They do a colonoscopy and they find that polyp and they snip it. They prevent that from progressing to cancer. So it saves lives. Or if somebody gets a FIT test, it's mass screening, so they can determine if somebody then needs a colonoscopy. It's covered. There is no copay. But why is it that colorectal cancer screening rates are so low when it is free and it saves lives? So that was my question. And so I did a literature review on everything related to colorectal cancer, reasons, why people thought that was the case, which populations are at high risk, a lot of research, literature review in that area. Then I narrowed my question and I said, okay, I think that maybe socioeconomic status and demographic factors may contribute to these low cancer screening rates. And my hypothesis was, yes, it does. And so the question is, to test that hypothesis, is that the case? And then moving on around the wheel, the research design. So I decided to use the electronic health record because the data is available. And all of us working in clinic, you live in the EHR. You have all of this information, all of this data. You can easily just use it. And I said, okay, the way I'm going to design this, I'll have two groups. The group that is at goal, that is compliant, has been screened according to the guidelines, and the group that has not been screened. And I'm going to compare these factors to see if they can explain why one group has not been screened. And the factors then had to be determined, which is income, gender, education, language, health insurance. And then I added other factors like comorbidities. Also looked at health provider visits. How many visits had they had in the clinic within the previous 2 years? Define my population as people with type 2 diabetes, African American and Hispanics. And the reason why I picked this is because in the literature, I found that people who have type 2 diabetes, regardless of their race or gender, are high risk for colorectal cancer. And they are least likely to be screened. And the same was for African Americans and Hispanics. So I chose to use this really vulnerable group of people who are either African American or Hispanic and have type 2 diabetes. And then had to determine the inclusion and exclusion criteria. For example, the age range, because we're talking about routine screening, the age range that is that is based on the USPSTF guidelines. So data collection, again, EHR. And when I went to the EHR, I could find the order that was put there for the fit test. These clinics that I'm working with use the fit test as their primary method of screening, and then they send people for colonoscopy if the fit test is positive. So I could see the order had been placed, but only a few people had the results in, and so the question was, the order was put in, but did the patient did the patient actually bring back the fit test, or did they not? So I had to go to the LabCorp data to look at the results. And actually what I found is that there were a lot of people in the EHR who did not have the results, they had not been transferred to the EHR. If I had just looked at the EHR, I would have said, oh, they haven't been screened, they're not compliant, they didn't bring it back. But when I went to LabCorp, I was able to find the data. And so you have to kind of keep evolving that way. So then the data analysis is just a comparison of the factors that we determined using simple analysis like Excel. And again, like I said, you can also use an analysis package. And then this report, we'll be writing a report when we're done with this study for the clinic to be able to say, okay, here are the patients in this clinic who are at high risk for not being screened. And so maybe some interventions directed at these people might be a good idea. And of course, we'll do manuscripts and posters and presentations and so on. So the next steps then is going to now generating new questions and continuing. And I want to show you just very, very preliminary study that is not all the data to kind of give you an idea of how you end up generating more results or more questions. So this is our very preliminary data. It may change because we don't have all the numbers in, but I want you to ignore the many numbers and just focus on the red. So basically what we're seeing is that people who speak Spanish, people who are overweight or obese, and people who are compliant with pneumonia and mammograms, or have a GI diagnosis or hypertension or cardiovascular disease, are actually more likely to be compliant with their screening. The other finding is that people who had higher number of clinic visits are also more likely to be screened. So, we're in this space where we ask the question, why is it that people whose primary language is Spanish more likely to be compliant with screening? Is there something about, maybe they worry more about colorectal cancer, and so they're more likely to seek that screening? And the people who have higher clinic visits, it makes sense because I think there's more opportunity for the provider to tell them about colorectal cancer screening. But what do we do with the patients who do not need to come to clinic as often because their diabetes is well controlled and they don't need to come as often? Is there something else we need to be doing with them to make sure that they're also hearing the message about colorectal cancer screening? So as you can see already, we're generating a lot of questions to again go through the wheel and start over another study. So this is my inspiration slide for you here, is that yes, you can. This is a project, this is a sliver of a larger project that I just shared. But this is a project that I submitted and was funded by American Cancer Society for $600,000 for 4 years. So it's definitely doable, and we'll talk a little bit about grant funding. But this is a project out of curiosity and just writing a proposal that turned out to be funded and is an ongoing study now. The second example is, again, my curiosity on why is there a lack of diversity in the PA profession? And as a program director, I've reviewed thousands of applications of students, aspiring PAs. And one of the things that I noticed early on as a program director is that, there were very few students who had certain characteristics. For example, race, ethnicity, people from low-income communities, rural areas, inner city, first-generation students, LGBTQ community, students with disabilities, and veterans. Why do we have such few of them applying? And why do we have very few of them matriculating? Because even the ones that apply, the rate of matriculation is even lower among this group. So I did extensive literature review on, the PA profession and other health professions to try and understand this issue of lack of diversity, and narrowed the question. And at this point, I decided that implementation research was a better option, because what I found is that we already know, we don't need to ask anymore whether the profession is diverse. We already know it's not as diverse as it could be. And we have some ideas of why it's not. So I decided, instead of asking questions, how about I take some of the answers that people have given already, try to implement them, and then look at the project and see if it was a success, and what are some best practices that then I can give to other people to use to help with their PA programs. So the hypothesis is that mentoring students and an enrichment program would increase the acceptance to PA programs. And as I said, this is an implementation research, focused on broad diversity parameters. And so these are the students that we are working with currently to help them get these interviews and actually be able to be successful as PA students. And the data collection and data analysis here is really tracking how many interviews they get, the acceptance rates, and then just doing surveys with them to see, how we can continually improve the program. So it doesn't always have to be a question you're asking. You can also do an implementation. Like we said, it's one of the research options that you have. Dissemination, we're going to be writing reports to our funder, writing manuscripts, just putting out some information there for PA programs to be able to use, and presenting at conferences. And we know we will have a lot of unanswered questions, and so we will be repeating the cycle again to answer more questions and improve on the process. And again, another inspiration slide. This project was a proposal. I submitted this to a biotech company that is interested in diversity in healthcare workforce, and we were able to get funding to work with these students. So yes, you can. You have that curiosity. Put it on paper and submit it. Somebody will see it and give you the money to do it. And I want to put a plug here for this EDGE PA program at Charles Drew University. I'll put the link in the chat when we're done. We're looking for mentors and shadowing preceptors. It's a national program, so we have students from all over the country. And so if somebody lives in your city, you might be interested in either mentoring or shadowing. If you're a mentor, you can be from anywhere because that's virtual. But if it's a shadowing opportunity, then if they're in your city, then you can invite them to shadow you, and we will be offering some little stipends to our mentors and preceptors. Okay. So how do you disseminate your work? Now you have your question, you've narrowed it down, you've gone through the wheel, and then now you're disseminating it. Book chapters is one way to disseminate that information. Book chapters are a lot easier to write than journal articles. Posters are very easy to put together. For conferences, you can write an opinion piece, you can write a case, you can write a report, you can write a pamphlet for your patients, you can do a presentation for your peers in your clinic on what you found. Just disseminate your findings as much as you can, and of course at national and state conferences and other conferences, just put your work out there. Some tips for you: make your work count more than once. So for example, you work in a health system, you're involved in the quality improvement committee, or the workflow committee, or you're in charge of maybe training medical assistants. Whatever it is that you're doing at your work, or you're working with patients who have very difficult patients with diabetes, use that, and you're already doing that in your work, use that to turn it into a research project that then you can disseminate. If you are enrolled in a doctorate program or MBA or any other program where you're learning and you're required to write papers for your classes, turn those papers into a manuscript or some sort of write-up that you can disseminate. So make it count for you more than once. You've already done the work, repackage it, turn it into something else that will benefit you. Then my second tip is collaborate. when you're writing manuscripts, for example, if you were just by yourself writing a manuscript, it's just your views, it's just your opinions, you're interpreting the data a certain way. But if there's three of you, you're able to do that collaboratively. And anyway, as PAs, we are the kings and queens of team-based work. Team sport is what we know. So collaborate with each other. If there's three of you, you might be able to put out 3 manuscripts instead of you doing one. So just really collaborate with others who have similar interests, and then just start. You're not going to be perfect the first time. The first manuscript you submit might not be accepted. The first grant you write might not be accepted. But guess what? It's been written. You get feedback. You repackage it, and you submit it again. So just start with what you have and what you know. So just a few words on the grant writing basics. This is an entire course or presentation by itself. So I'll just give you very few tips that have worked for me. Just be really clear about your topic. Funders don't like vague information. Just be really specific with what it is that you're trying to do. And then research your funder well. What are their strategic goals? What do they care about? How can you connect with them? How does your what you're interested in connect with them? And then tell a convincing story, but it has to be realistic. Sometimes when I started writing grants, I would be so ambitious and I would say I'll do all of these things because I really want to impress them so they can give me the funding. But then once you get the funding, now you have to do what you said you would do. And if it is not realistic, it's going to be difficult. And sometimes they can read through that and say, this is just not doable. We won't fund this. So be convincing, but make sure that your story is realistic. And then make sure you're following the guidelines and procedures. I've started in grant review committees, and people just make the littlest mistakes. A great proposal, but then they didn't follow the guidelines. And a lot of times, your proposal does not get to the people who make the decision first. It goes through a clerical process where they just have a checklist. Did you do just A, B, C, D? And if you didn't, it doesn't even get to the people who matter. So make sure you're following the guidelines and the procedures. Seek mentorship if you've never done this before. AAPA is a great place for you to find a mentor. And if you know how to do this, then offer a mentorship. And then one of the things that I have learned recently is, really adding other people to your budget. So in my, because I as a program director, I'm busy, so what I do now, and as you can see, my grants are large, and so they require a lot of work, because they're not going to give you a lot of money for just a little bit of work. It's got to be enough work for them to fund you that way. Otherwise, they'll give you less money if you're doing just a little bit of work. So what I do now is I just make sure that in my budget, I have written in assistants, data collectors, people who will help me do the work. And I do mostly the overseeing and the brain work, and because it's my work, I dreamt it. So I oversee the work and I supervise the team, and they get most of the work done. So for my cancer project, for example, it's larger than what I showed, but there's a part-time project manager, there's a full-time research associate, there's like 5 research assistants and some students who are doing data collection. So it's a huge team, but that really does help. And so I write that in my budget, and I pay them, and I pay them well, so they can get the work done. And it's also a process of mentoring them, because my hope is that they will also grow into become PIs in the future and write their own grants, and they get involved in the manuscripts that we write. So it's a team effort where everybody wins. And then start early. If you see a grant proposal, you got to start early. Where do you find grants? Targeted Google searches, go to companies that you think do the kind of work that you're interested in. And then AAPA and PAEA also offer some grants, so you could start there. So we have only a few minutes, so we're going to really quickly talk about AI tools that can help you with your research and your scholarship in general. They're your friend, but you have to be careful with them. Consider the ethics associated with its plagiarism, data privacy, and accuracy. Now, when you submit manuscripts, publishers have a way of running manuscripts through an AI checker, and they would be able to tell if AI wrote that manuscript. So you have to be careful with that. You don't want to be put in a black box. There is a black box that is public of people who have plagiarized material. So So you want to be really careful with this. And we also know that AI is not accurate. Sometimes it will just hallucinate and, just do its own thing. But it can be your friend and it can save you a lot of time. So I'll give you just some examples. This is just a very small um, slide just showing some examples of AI tools that you can use in research. And this is probably a quarter of the ones that are out there. There's so many out there now, and you can get really overwhelmed. I think every week I learn about a new one that's out there. So there's a lot of them. For any of the ones in here, you just type in the name in Google. You'll be able to see what it is and what it does. I'm going to just show you two that I have used in the past, and hopefully that will help you get started. So before we show those, here are some ways that you could use AI in research. For brainstorming, when you're just trying to think about, I'm not sure if this is even a question that I should ask, ChatGPT, Google Bard, and Perplexity are really good ones that you can go to and just type your question, and it will tell you, oh, this is what other people have done about this. Think of this as ChatGPT, for example, as your brainstorming buddy. It's like you're sitting next to somebody and you're just brainstorming ideas. So you can converse back and forth with ChatGPT and just brainstorm some ideas that you have. And then for refining your query, this is where now you go to the peer-reviewed sources. And there's many GPTs also that can help you with this. But PubMed is a lot easier. So you could stick with PubMed, put in some key terms, and see what comes out. And then for collecting and organizing your resources, PubMed has a really good way where you can just say, show me, you've put some search terms, there's like 500 articles, and then you say, just give me the abstract, just show me just the abstracts of all of this. I don't want to read anything else. And it will develop that for you. And then I'll show you Elicit and Research Rabbit and how you can use that to organize your resources. To restructure your manuscript, many GPTs, including ChatGPT, can help you to structure your manuscript. There's always guidelines on how they want the manuscript structured, but GPTs can give you sort of some ideas of how you could do it. And then for writing your manuscript, I think most of us are familiar with Grammarly. A newer one is WordTune. And then when you read articles, how you see so many references at the end, and you see all of these in-text citations. Those can be a pain. So you want to use a citation manager to help you manage those. And Mendeley, Zotero, EndNote, and others are out there that can help you with that. Okay. So this is an example of elicit.com, and I've used this before to organize my articles and content. And I apologize, it's not a very clear slide, so I'll try to take you through it a little bit. So what you see here, what I went in and asked was that I asked this prompt: what is the relationship between physician assistant admission variables and PANCE performance, right? And what Elicit did is it looked everywhere for all articles that have been written related to this topic. And then it created a table for me. I used to do this before in Excel, and it was messy. But now Elicit can do it for you. So this is the first article that it brought me. This is the title of the article and the authors. It gives me an abstract summary in like 1 or 2 sentences. And then it tells me the number of participants in that study. And then it tells me just 3 bullet points of the main findings in that manuscript. And I asked about, detailed study design, and it gives me the design that was used in this study. And you can ask a few other things. So basically this manuscript, which is like maybe, 5 or 6 pages long, it gave me a quick summary of this manuscript. And then it gives me the next one. So now I have 3, I'm only showing 3 here, was probably 50 or 60, down this table. But now if I wanted to just understand the kind of study design that people are using with this topic, I can look at this column and get an idea of all the different designs that are out there. If I just want to brainstorm the main findings on this topic, I can just look at this column right here, main findings, and I'll get the bullet points of what are the main findings in this, and I can start to compare those two. If I want to see, just the summary of the abstracts, if I want to see the people who are doing this work, I can just see their names here. So it creates this massive table for you where you can compare different articles in just one snapshot. previously you would have to print all of this, 50 articles and then, highlight every different one on the main findings and so on. But here you have this and you can export it to Excel. So it's a very good way for you to get started, to kind of start to think, see what's written out there, and get a little bit of information on each of the manuscripts. Then the ones that you really like, you can find the full text and read it, a little further. There is a free version for Licit that's a little bit limited, but it's doable. I think if you're starting, you don't need to pay for the paid version. And the paid version does a little bit more for you. So that's illicit.com. And there's several other ones that have come out that do kind of similar work, but I do like Illicit. Another one is researchrabbit.ai. This one is it also helps you find articles. So you can do PubMed, which is great. And I always go back to PubMed because these AI tools are pulling from main resources like PubMed, and they could miss something. So you always have to go back to PubMed. But for this Research Rabbit, I went in and I just put the prompt: Pence, admissions, physician assistant. And it came up with these blue boxes that you see here are the articles, in addition to many other ones. I'm only showing a screenshot of the ones that have talked about this. And then I selected these 4 and I said, show me similar work that is similar to this one's. And the next column next here, similar work, is now 331 similar work articles that have been written in this area. And there's all 331 of them for me to look at. If I want to look at the authors that are doing this work, I can click here and there's 91 authors that I can find. And then if you want to go even further, you can see these connections where it shows you this article was written by this person, it was cited by this person, and this other person cited it, and then it came around and this other person cited it, and so on. So if you want to see the connections, to be able to find who's citing who, or be able to find other articles, or which ones have been cited the most, which ones are more exciting, looks like people are citing them the most, then you can use that map to do that. So those are 2 examples to help you manage your articles so that you're not overwhelmed when you have so many of them. Okay. In terms of writing, I think we all have seen ads for Grammarly. I do use Grammarly, sometimes, and it also has a good plagiarism option here, so that you're able to see, sometimes when you're writing, you say a certain thing and you're like, maybe I read it somewhere and I'm writing it almost the same way. Then it will tell you if this is considered plagiarism, and then you can change your writing a little bit. Wordtune is newer, but and Grammarly, I think, now has this feature. But then in Wordtune, you go to this page, it's like a Word document, you write a statement, and then you can highlight the statement and ask it to give you other ways of saying the same thing. And then it gives you options of another way that you could say that statement, and you can select which one you like. You have to be really careful with it because sometimes it changes the meaning. When I started using Wordtune, I used it frequently, and then I realized it was too time consuming. It was just easier for me to write it myself. So play around with it. But I still go back to it when I'm like, I don't really think this sounds the way I want it to sound. Let me see how AI would say it. And sometimes it says it better. So you have to be careful with the plagiarism of it, but it gives you idea. It just gives you another little edge that maybe you didn't have before. We talked a little bit about in-text citations and references. If you're writing something that is really long with a lot of references, you want to use a citation manager. It takes time to learn how to use one, but once you learn it, it will really help you in the future. Zotero and Mendeley and Google Reference are free. EndNote you have to purchase, but Zotero and Mendeley, work just as well. And you can share these resources. So if you're collaborating with somebody else, you can share your Zotero file with all your documents, all your articles, and you're able to collaborate together with them. And everybody can keep adding articles to the citation manager. Okay, so we've talked about the importance of doing, research and scholarship. We've talked about how you actually come up with a question, how you synthesize it, and how you go through the wheel. We've looked at some examples of how that can be done. We've talked a little bit about grant writing and about using AI. And all those are really just high level information on how you can do that. Um, but I would be lying if I said it's easy. It's not easy, but it is doable, right? If you really want to do this, you can learn how to do it and do it well. So it is time consuming, so I think I've said several times, collaborate with others. It can be expensive, especially if you choose to collect data yourself, if you don't have ready data. So try to find grants for that or use existing data. And then your results are really going to be dependent on your study design. If you design your study well at the beginning, then your findings are going to be useful. So make sure you're starting right. And then there's always biases that come when you're doing research. You can't possibly study everything. You can't possibly control for everything. So just realize that. But using approved research methods is going to minimize those. And then whenever you write, you always have to declare your limitations. But that being said, there's some challenges, just like with everything else, but it is absolutely worth it, and it is something that as PAs we should absolutely do. There's a lot of resources out there on how to do research and broadly scholarship. A lot of books, short courses in Coursera, in LinkedIn. You can do a course. YouTube is actually, I think, the first place to start. There's a lot of people just giving information on how to write a question, how to do literature review. All these AI resources. There's some people who actually review them and they show you how to use them. And there's a couple other websites that you can go to for grant writing. Google is your best friend when it comes to grants, to find grants. And so I hope that I have inspired all of you to get started, or at least to try and to seek out mentorship and just give it a go.
Lucy, thank you so much. That was awesome. I'm feeling inspired, but the audience is going to get sick of hearing this. Every single talk, I feel like I want to run through a wall afterwards. So this was amazing. And I just want to echo, I'm just now starting to get into the research side of things. I've been a sub-I on many studies. I'm trying to get a PI role in an investigational study. But even right now, I just wrote a grant for an industry company, and they're funding it. And you're right, because there's some data collection coming with that. And it's amazing how fast it burns through money when you're having to have someone who is on staff collect data. So I think my point of advice with that after watching this is sometimes the numbers are a little bit shocking when you look at them. If you see a 6-figure grant, you think that's a lot of money, but it really does go quickly. So make sure you don't undersell on your grant, because there is a lot of cost that comes in that. The other thing I want to highlight before we get to the questions that we have is thank you so much for those resources at the end. My goodness, I wasn't familiar with any of those, and they look incredible. Just the AI that we have out there and how to use AI too. I do love the idea of using ChatGPT to maybe help if you're stuck and inspire you in what direction to go, but not necessarily to create the content for us. So I just am so excited to explore those things that you did. All right, so here's a question for us. What is the protocol for using your EHR database for research? Do you need permission?
Yes and no. It depends on what you're doing it for. So if you're doing a QI project for your health system or your clinic, you can pull out the data and use it. I'll give you an example. When I was working at a community health center, I realized I was taking care of a lot of patients who had diabetes, and I noticed that they were coming in, and we would check their A1C point of care when they came in, and it would be a certain number. And they were doing everything. We would change the insulin and everything, but those numbers were just not changing. And so I started doing it in-house and also having them get blood drawn for it to be sent out. So we did do an A1C on the same day on both of them. I suspected that there was something wrong with our equipment. And so I did just 10 cases, using the EHR, the ones that we did in-house and the ones that came back. And sure enough, on all 10 of them, the A1C was like 3 or 4 points higher in the clinic than when we sent it out. So that was something that I used the EHR, and we ended up just throwing all our in-house machines and buying new ones, and we realized they were not calibrating them. That's why there was a problem. So here we were changing people's insulin, changing their treatment protocol based on incorrect results. So that's an example where you don't need IRB, you don't need anything. You're curious, you do that. I presented that to my team. It's only 10 cases. But if you want to do, a full-blown research where you're going to be disseminating the results or, writing manuscripts, then you need an IRB. And so it might be in your health system. If there's one, if there's none, you would have to collaborate with an institution that has one, and then you can get that IRB. If the data is de-identified that you're going to use, you're not going to identify any of the patients, then you don't need to obtain consent from the patients, and the IRB will exempt that. But if you're going to include any identifying information from the patients, then you need consent from the patients. I hope that answered your question.
Excellent. So here we have another one. Is there a good course or online training for someone as a starting point for research? So maybe I'm going to interpret that if someone is research naive, you mentioned a lot of online courses. Would there be one that sticks out to you as a good starting point for someone?
I honestly will advise you to start with YouTube, because YouTube videos they're very short. They explain it very well. Start there, right? Just to kind of be curious, and then Coursera has a lot of free courses, and LinkedIn, they have a lot of free courses on starting research. There's a lot of books. Also, just find a Research Made Easy book and go through it. If you're near, if you have access to an institution, you can take a course on research methods, for example. So it depends on how deep you want to do this. But I would say if you just want to kind of get an idea, use those online resources. If you really want to be deep into it and do it long term, then taking a course in like research methods, for example, would be a good idea.
Wonderful. All right. Well, it looks like that is it for the questions. We do have one more minute, which I'm going to take to just, Lucy, thank you so much. This was amazing. I love it. We've now had 2 separate talks on research, and I'm just so glad for it because I think this is a final frontier or the next frontier for both PAs and NPs. It's such an important part of medicine, and I worry that as we have more of a physician shortage, research and scholarship historically has been a key part of physician training and physician roles in academia, and yet I just think our younger professions have not embraced that as such a core feature of making sure that we're moving healthcare forward. So I'm just so happy to have you lending your voice to it. I'm going to finish with the joke. I joked about the tennis balls being there, but it's 6 degrees and I have a foot of snow. So this is why I'm so hyper focused on the fact that you have tennis balls out, because it means you're probably a little bit warmer than I am here in Buffalo. So I'm very jealous of the sunshine.
70 degrees here. 70 degrees.
Must be nice.
Yeah.
Well,
Yeah.
Lucy, thank you so much.